Alcohol has a direct and damaging impact on the liver, making it one of the most critical substances to avoid when liver enzyme levels are elevated. The liver is the primary organ responsible for metabolizing alcohol, and even small amounts can place a heavy burden on an already stressed system. When alcohol is broken down, it generates toxic byproducts such as acetaldehyde and reactive oxygen species, which cause oxidative stress and inflammation within liver cells. These harmful effects contribute directly to cell injury, which is reflected in rising levels of enzymes like ALT, alanine aminotransferase, and AST, aspartate aminotransferase, in the bloodstream. These enzymes are typically contained within liver cells, and their appearance in the blood indicates that the liver's membranes have been compromised. While many people associate liver damage with heavy or chronic drinking, even moderate or social alcohol use can exacerbate liver enzyme elevations in individuals who already have a vulnerable liver due to fatty liver disease, hepatitis, or drug-induced injury. In some cases, just one episode of alcohol consumption can trigger a noticeable spike in liver enzyme levels. Chronic alcohol use causes repeated cycles of inflammation and healing that lead to scar tissue formation, a process known as fibrosis. Over time, this can progress to cirrhosis, a permanent and potentially fatal form of liver damage. Moreover, alcohol can increase fat accumulation in the liver, alcoholic fatty liver, interfere with normal liver metabolism, and impair the body's ability to clear toxins and regulate blood sugar levels. In individuals with non-alcoholic fatty liver disease, NEFLD, alcohol acts as a compounding factor, further accelerating liver injury and making recovery more difficult. Another critical issue is that alcohol can mask or complicate the interpretation of liver enzyme results. Some people might assume that just a little drinking won't make a difference, especially if their enzyme levels are only mildly elevated. However, the damage may not be immediately visible and could manifest later as a more serious form of liver disease. Additionally, alcohol may interact dangerously with medications metabolized by the liver, further increasing the risk of hepatotoxicity. Complete avoidance of alcohol is strongly advised for anyone with elevated liver enzymes, regardless of the suspected cause. This is not just a precaution, it is a fundamental part of liver care and recovery. Cutting out alcohol gives the liver a chance to repair itself, reduce enzyme levels, and regain function. While social and cultural pressures may make abstaining from alcohol challenging, the health benefits of quitting are substantial and often noticeable within weeks. Liver enzymes typically begin to decline once alcohol is removed from the diet, especially when combined with other supportive lifestyle changes like improved nutrition and weight management. In summary, alcohol poses a significant and often underestimated threat to liver health. When liver enzymes are high, alcohol is not just unhelpful, it is actively harmful. Eliminating it entirely is one of the most effective steps a person can take to prevent further damage, support healing, and reduce the risk of long-term liver disease.